Okay, welcome everybody. Happy Friday. This is our daily COVID-19 press briefing. I'll start out as always with the numbers. We have 3 positive cases still. We have a different way that we're reporting our negative numbers today. We now have the number of tests that have been run in our commercial labs. So we have a total of 189 negative tests in Shasta County, including 110 from the public health lab and 79 from our commercial labs. We have 1 person in isolation still, 17 on quarantine, and we have 1 death. We'd love to go around and do a round of introductions and allow all of you to give your updates. So who do we start with yesterday? Let's start with Mayers today.
Good morning. My name is Valerie Lakey. I'm with Mayers Memorial Hospital District in Fall River Mills. And each day we have pretty much seen the same thing up here this week. And we're just still preparing for what could come. We feel like we're pretty prepared as we can be. And we're just checking our processes daily and trying to make sure that all the little details are in place.
All right. Thank you. Mercy.
I'm Kenneth Luke, the Director for Security and Emergency Management. We've been doing the same thing, just preparing, working with our inpatient teams, getting them educated and up to date and ready to go.
All right, thank you. Shasta Regional Medical Center.
Hi there, my name is Mark Mitchelson. I'm the Chief Nursing Officer here for Shasta Regional. And similar to what Ken's saying, many of our plans and implementations are in place right now, just continuing to screen any potential patients and testing for CDC guidelines, continuing our no visitor policy. And one thing that we have done, it's fairly new, is that our medical group is starting to do virtual visits. So if any existing patients want to have doctor visits, they can go to shastaregionalmedicalgroup.com and request a virtual visit from the doctor.
All right, fantastic. Dr. Ramstrom.
Good morning, everybody. I don't have any specific updates. We're just really focusing in the last few days on maximizing our testing capacity. We have a lot of limitations based on supplies that are not available. And so getting communications out to providers about that and talking with the other healthcare partners on this phone to just sort of coordinate and make sure that we're using our resources to the best of our ability. Hoping that changes soon. We're as frustrated as everybody about that, but we do have some significant testing limitations here in the North State. Other than that, really just continuing to prepare, as was mentioned by everybody else, starting to look a little bit more closely at some modeling in our data and hoping to have more of that information to share next week.
Thank you, Karen. Brandy Isola.
Thanks. I echo everything that Dr. Ramstrom just said, but I also would like to update the community about our efforts working with law enforcement. We have a process for complaints from the community about non-essential businesses and still being open and just in general, people not following the governor's stay-at-home order. So we continue to work on educating businesses and really encouraging them to follow the stay-at-home order, but also to practice safe infection control guidelines. And we're really happy that our community is responding as well as they have to the governor's stay-at-home orders, and we just hope to see that increase in the future.
All right, thank you, Brandy. I do have some questions that came in from the public through our Facebook page, but I'd like to give our media folks an opportunity to ask questions first. So what do you have for us, friends from the media?
This is Darren from KRCR. It sounds like, our numbers are remaining fairly consistent as far as those in isolation, quarantine, and those 3 positive cases. I guess is no new news good news as far as, the state of controlling this thing a little bit better in the county?
So I can take that. I think it's hard to say. My hope is that people staying at home, social distancing, the expectation and the intention of that is actually to spread out our cases so that they don't overwhelm the healthcare system. So as we look at trends over time, I think we're going to have more cases, but my hope is that those are spaced out, and our kind of social distancing measures are going to need to stay in place for some time to see that that trend continue. So we like that. I think we're going to get more cases, but happy that they're not happening, daily, and we'll continue to monitor that.
Thank you.
All right. Mike Chapman from the Record Searchlight. This is a national question sort of brought down to the local level. We've heard governors talking about the need for ventilators. So I'm just curious how Mercy and SRMC, are you guys fixed for ventilators in case we get more cases?
We do. We have plenty of our normal ventilators that we use every single day. We have more that are on order, and we actually have quite a few disaster ventilators that allow us to care for up to 70 people.
Okay. And for us, for our ventilator capacity, we're about 50, which is far more than what we currently use on a daily basis. So I think if there's a major surge with people needing ventilated, we're more than prepared for it.
Great, thanks. Well, I can ask another question. Robert Forden yesterday was talking about preparing the surge plans. Can you guys give us any more details about what the surge plans entail?
Surge plan, there's a lot of moving parts when it comes to a surge plan. We have our front end process, which is in our emergency room. So we've been working diligently over the past few weeks to fine tune that process. We actually spend many hours educating our emergency room physicians and nurses and ancillary staff to those plans each year. And now we're actually working on our inpatient process on where we're going to put patients and converting rooms that normally aren't negative pressure over into negative pressure rooms, and looking at step by step as an event grows where we're going to place patients and things like that.
Okay.
I'll go ahead and address for Mayer's, for our surge plan. We're much smaller. We're a critical access hospital, and we only have 16 regular beds. We can surge probably up to about 22 total. We only have 4 ventilators. So we, just like every other hospital, are required to have a surge plan and test that regularly. So we train and educate annually with our staff so that we can manage what would come into our small community. With that said, we work very closely with our larger partners in Reading at Shasta Regional and Mercy, because a lot of the times we would transfer patients to a larger facility where they have the ability to take care of more complex patients. And then on the other side of that, we were discussing yesterday at a surge planning meeting that potentially we could take back some of the patients that had the need for a lesser level of care. So it's really important for us to all work together and to collaborate with our surge plans, because within Shasta County, we need to be able to know what each other's capabilities are so that we can address the needs of our communities the best.
All right, thanks.
Other questions from our media before we get into the handful of questions we have from other folks?
Well, I'll ask another. Mike Chapman, Record Searchlight.
Sure, of course.
In case there is a surge of patients, have the hospitals asked about regular doctors and like general practitioners and offices around town to like all hands on deck in case you need them?
We have actually been having meetings weekly with our county partners, and all the hospitals together meet once a week. And we discuss not just places that in our facilities where we can take care of patients, but other areas of our city where we could potentially house patients and care for patients, and working with those nurses and staff who could work at clinics or surgery centers or things like that that are actually closed down right now, onboarding those staff to help us out during a big surge.
Wow. Okay. Well, then another question, Mike Chapman, Record Searchlight. Have you heard of this disaster healthcare volunteer database? I heard down in Butte County, they're looking at that for maybe people to help volunteer in case they're needed.
Yes, we actually have one here in our county as well.
Oh, great.
And we just had some conversations this morning about, as Kenneth said, some of these other patient facilities or medical establishments might not be seeing the same level of patients. And so we're thinking about doing a new recruitment to see if there's individuals out there who'd be interested in signing up for as a disaster healthcare volunteer.
Wow. Okay.
Okay, any other immediate questions?
Yeah, Mike Chapman again.
Sure, of course.
We have that drop off at Bethel Church. Does anybody know how that's going with supplies being turned in?
I have not heard. Has anybody else? I don't know.
Okay.
We just started spreading the word yesterday, so
yeah.
I'm not certain if they've had folks drop things off yet. We can check.
Yeah. Okay. Well, thanks.
Okay. So we have a few questions. There are some questions that are coming through that we have already answered in prior briefings. My community relations team will actually go back into Facebook and answer those for those folks, so we don't take up your time with those. But some of them include, is antibody testing in the plan for the future?
So we're hoping, and it's sort of, there are some tests out there that are being used now more for surveillance purposes in communities that have been hard hit. But we haven't, as far as I know, there are not approved tests yet that can be used for clinical purposes. So because there are at least some preliminary tests available, I think that we're going to see more of that coming along, and looking forward to that, because as we have more transmission, it'll give us an idea about our level of community immunity at some point. So stay tuned for that.
You're on mute, Carrie.
Gosh. In the case of the woman who died, did the epidemiologists from both counties work together and share information regarding transmission?
So I can answer that. We always work across county lines when we do case investigations. And so our communicable disease response and investigation team is used to making contact with other public health departments in lots of other counties. And so we do that regularly. And we, of course, are doing it more vigilantly now. And it's just kind of an interesting situation because so many other counties are overwhelmed and they aren't able to do as much containment as we are, but we definitely work across lines to make sure that the spread, that we can slow the spread together.
Thank you. For our hospital partners, what are the guidelines for healthcare providers regarding personal protective equipment in public hospital areas like hallways, lobbies, and cafeterias?
I'll take that first if you'd like. So in our facility, we have closed at this current time, closed all of our public areas, and people can only enter our facility at one location. We're a smaller facility, so we don't have as many challenges as the larger ones in Reading. But as far as the process for PPE for our providers, in our emergency department, it is really right now just the same as it has always been, because we're seeing any potential patients in an isolation trailer outside. So when that happens, our providers and the rest of our staff practice the proper procedure for donning and doffing their protective equipment. And then, so none of that happens inside of our facility. The rest of the facility, the way they would handle being within the hospital would be just the same way it has been prior to COVID. So everything is contained outside of the facility at this point.
Correct. And for us, because of many of the elective services being reduced and shut down, currently there's not that large amount of public traffic that you're seeing within typical hospital timeframes. So really our recommendation is still just following the typical, if you have a suspected or confirmed patient that needs to be in isolation, we use our isolation PPE then. Otherwise, we just do regular hand hygiene and standard precautions.
All right, thank you. With the governor saying that the California needs to add 50,000 additional hospital beds to prepare for an upcoming surge, what is Shasta County doing to increase the number of hospital beds in our county? I think you touched on that a little bit already.
We, like I said before, we have been looking at other areas of our facility along with Mayers and SRMC. I'm sure they're doing the exact same thing. We look at other areas that we can potentially put patients. We look at converting areas that are normally for one type of patient into another type of patient. We work with the state as far as getting variances for those plans. So this is just things that we do on a normal basis and have plans for on a normal basis.
Okay. Anybody else want to add anything on that one? Okay.
I would just add that as a part of our emergency operations plan, we are required, we always have alternate care sites. So we just look at the acuity of a patient, and we, in a worst case scenario, would need to implement some of our alternate care sites.
There's a question about Advil and ibuprofen being unsafe with COVID-19. They are not finding anything to support the findings in CDC or CDPH. Do we have any kind of insight on that, on whether people should not take Advil or ibuprofen if they believe that they may have COVID-19?
So I haven't seen anything. It is possible that there's some case studies coming out with some information, but I have not seen any change in recommendations for using those medications, which we normally use for other types of viral illnesses for managing discomfort and fever.
Okay. And our last question was about reopening of the schools. I believe that decision was made by the county school superintendent. Is that correct? So that would be the person that would.
No, I can answer that. The
Okay,
county superintendent of schools does not have the authority to close schools countywide. That is made in each district level. So
Got
each
it. Okay.
makes those decisions. And
so that's not something that would be made by public health. It's up to the individual school districts.
I think that we've been working really closely with the school superintendent as well as all of the school administrators, especially up until the point where they decided to close. It's been a little quieter in the last week or two since most of the schools have been doing online learning. Mm-hmm. But I anticipate that when there start to be decisions about when to reopen, that they would reach out to us.
And we will be sure and spread that, help them spread that information as well. All right, do we have any other questions from the media?
I'm good.
Okay. So I wanted to let all of you know that starting next week, since these briefings have slowed down a little bit, that we're going to change our press briefings to be Monday, Wednesday, and Friday on video like we're doing right now. And on Tuesdays and Thursdays, we'll just post a written Facebook update at 11 o'clock because that's when folks are accustomed to seeing these. With our information, our updated numbers, plus anything that our healthcare providers have to add to our daily updates. If something new arises, of course, we will exercise this option to let all you know, and we'll all hop on and add in-person, in-person briefings as needed. But otherwise, that's the plan for next week. We're going to send out a new invitation to all of you with information, but the plan. All right. Any other questions, comments? Okay. Thank you all again for being here. I hope it's a nice, quiet, restful weekend for everyone.
Thank you.
Thank you.
See you on Monday.
Thank you, Darren and Mike.
Yes.
Okay, thank you.
Thanks.